Why therapy doesn't always work. Therapy doesn't always work, and very simply put, it comes down to two things. One, the method does not match the problem. For example, if someone suffers from OCD, and in therapy they only talk about their childhood experiences, that in itself is not going to help change the belief that intrusive thoughts are dangerous. And we do know that it is these beliefs about thoughts that maintain OCD. Or for example, if someone struggles with or suffers from panic disorder and they only learn coping skills when they feel anxious, that is not going to change the belief that anxiety is harmless and is not going to drive them mad or become uncontrollable. Similarly, if someone struggles with communication in their relationships and just coming into therapy and talking about the things that are not working in these relationships, of course, will not help them be able to change things outside of therapy. The second reason is that the method does work, but you're not applying it yet, or you're not applying that consistently. For example, my experience is that if you don't understand why you should be applying the strategies that you learn in therapy, you will not start applying them. If you don't understand the rationale for why this would work and why this would be helpful for you in particular, you're not going to be very motivated to apply them. Another experience that I have with clients is that when things become very difficult and very intense and uncontrollable, my clients sometimes forget to apply the strategies consistently. So maybe they start applying some of these techniques that we talked about. For example, leaving a thought alone instead of worrying about it. But once the thoughts become very pressing or the feelings became very intense, they stop doing that. So it's all about applying it and understanding the rationale for it and also doing that consistently. But there may be other reasons why you're not applying the method, although it is effective. A common one is that you don't believe that you can improve. Maybe you believe that you've been going through too much to be able to ever recover. Maybe you feel that you're so broken inside from all these past experiences that you've had, or from having struggled with this particular mental illness that you're beyond repair. So holding on to an idea like that you're beyond repair or that you cannot improve may make you demotivated for actually applying the strategies that you learn in therapy and to feel better. However, these are only ideas that you've come to believe at some point and not facts. And one way to really test them out is actually to apply the techniques that you learn in therapy to help you prove that you are, of course, capable of overcoming mental illness. Another reason could also be that you're simply just not ready. Some people might say there's no right time to start therapy, to start improving things, but I actually do believe that there is. Sometimes you're just not ready to take on that responsibility. Maybe you're just not ready to invest the time to actually come to the sessions and show up. Maybe you don't feel like having the energy to apply the strategies that you need to do in order to improve. So maybe things just feel overwhelming in your life. Maybe you have too many things going on, too many projects that need to finish. Maybe you're about to go on a big trip and you don't have the time to invest in therapy. So of course, there's a time and place for starting working with things, and the more you feel ready to invest that time and energy, the better the outcome. So all these reasons are valid, and there's no shame in not feeling like you can improve and not feeling ready to start therapy just yet. But therapy is effective if the right method matches the right timing. I've had clients, for example, who after one session started applying the strategies that I told them to and changed things around. I've had clients come back telling me how things massively improved for them. And that was not luck. That was just because they were ready, they were open to apply the things we talked about, and they did apply it consistently. I've also had clients in therapy who kept circling around the topic, who didn't really improve, took one step forward, one step back, and ended up being in therapy for about almost a year. Mainly because they didn't feel ready or they didn't want to work with the thing that needed to be worked on. Therapy, of course, doesn't work for everyone, But to increase the chance that it does, you need to feel ready for it, and you need to find the right method that's a good fit for you and your problems.